Hi, I'm Dr. Elena Zinkoff. I'm a board certified naturopathic medical doctor and I specialize in women's health. And one of the most common questions I receive from women is, should I cycle my progesterone or not? Meaning, should I just take my progesterone days 14 through 28 of the cycle? And it's not a yes or no question. It really depends on your unique individual response. I have some women who take progesterone nightly, and I have some women in my private practice who take progesterone just in that second half of the cycle. I also have patients who take a lower dose of progesterone days 1 through 14 and a higher dose of progesterone days 15 through 28. So, progesterone is critical for women. It supports our mood, sleep. It also helps to regulate our skin. So, we're more likely to have more acne when we're low on progesterone. It's also fantastic for hair and can prevent hair loss. When we start to feel a little bit more achy, more inflamed, that's another sign that progesterone is starting to tank. So, in a lot of women, we start them on progesterone in a cyclical form, meaning we dose it days 14 through 28 of the cycle. And we pay attention. How do we feel? If you feel great in that second half of the cycle and then you feel horrible when you're off progesterone in that first half of the cycle, that means that you probably need progesterone support throughout the month and not just in that second half of the cycle. If you are someone who is taking progesterone nightly, but you're feeling more puffy, you're having more water retention, maybe you are actually breaking out more or feeling like your skin is more oily, chances are you could either benefit from a lower dose progesterone or it might not be a bad idea to actually cycle it. So there's no wrong or right way of doing this. It really depends on your individual response. The other thing I want to mention, it's not just the timing of progesterone, but the dose that matters as well. I frequently use compounding pharmacies in order to start women on a much lower progesterone dose compared to the what we have access to in conventional pharmacies. So sometimes I'll start women on 25 milligrams or as low as 6.25 milligrams of progesterone. Sometimes we start them on a cream instead of an oral form, oral micronized progesterone. In conventional pharmacies, the lowest dose is 100 milligrams, and that is sometimes too much for women. So I'd love to hear from you. What questions do you have, whether it's about progesterone or other hormones? Comment below.